Y'all know me, I'm Dr. B, and this is The Buzz on Impetigo. Okay, so first things first, it's Impetigo. It's a weird word. A lot of people say infantigo, like it's something infants get, but that's not what it is. It's impetigo. It is, by definition, a superficial skin infection usually caused by staph or strep bacteria. Staph and strep bacteria are part of our normal environment. They can infect healthy skin, but usually what they're looking for is a way to get into the skin. So, some kind of break in the skin. And that can come in the form of bug bites or from abrasions, underlying skin problems like eczema, or someone who scratches at their skin because they have allergies or they're itchy. And in older kids, kids who are shaving their face, legs, or underarm, these bacteria can get into the skin through razor burn. This is why kids are such a great target for staph and strep infections, is because what do? They get bug bites, they get scrapes, they pick or scratch at their skin. So what you got to do for these kids especially, keep their hands clean, keep their nails clean, keep their nails short and filed so that they're not scratching and digging into their skin. The usual story we get with a child who has developed impetigo is that it started with just a bug bite or started with just a scrape, but for some reason it wasn't healing. And then they started to get some redness around that, and then they started to get some sores that weren't even related to the original injury. They start to spread out across the body. Or in the case of this child has a runny nose, and maybe the parents have been wiping it a lot, and you start to get redness and sores start to develop around that. And you can see the one that's spread out onto this child's cheek. There are two forms of impetigo, and they're treated the same way, really, but let's take a look at them so you know what to watch for. The first is non-bullous impetigo, which is what you see in this picture of the child with the runny nose and the cheek sore. This is about 70% of cases, and there are little clusters of small red blisters and pustules that turn into these superficial, what we call erosions. It looks like the skin is kind of broken down in these little spots, and you'll start to get some orange crusting on that. You'll hear me say that a lot in the office. There's honey crusting. It looks like honey's been splattered on there and it's clustered up. This is usually found, this non-bullous impetigo is usually found on the face in the extremities. And the cause of this is by the bacteria Staph aureus and Streptococcus pyogenes, or group A strep. And that, as it so happens, is also the same kind of strep that causes strep throat. The other type of impetigo is called bullous impetigo. This is, there are not as many cases of this, maybe about 30%, about a third of kids with impetigo will have this. A bulla is a big fluid filled blister, and you can see two or three big ones in this picture, and some of them have popped already. What they'll do is they'll pop and they'll leave this scabby erosion. And here's one on a belly, and you can see the big open scabby sore there. This is very often on the trunk and on the arms. Remember that the non-bullous type, the more common type, we see a lot on the face and the neck. But this type you can see also on bums, and here's a bunch on a bum, and that looks pretty painful. These are due specifically to Staphylococcus aureus, which puts out a toxin that creates this big bubble type of impetigo. If you catch impetigo early, maybe there's only one or two lesions, just started, well, then you can probably get away with just using a topical antibiotic like mupirocin. If not, if you start to see the lesions are starting to spread and multiply, and you start to get ones far away from the original site, then you might have to use an oral antibiotics. Because in the end, if you're using that topical and it just keeps spreading, what you're going to find is that you fix the first lesion and another one shows up, and then fix that and another one shows up. You just start chasing it all over the body. So at that point, we probably have to put the child on oral antibiotics. Now, oral antibiotics, the common ones that we use are amoxicillin, cephalosporins like cephalexin or ceftonir, clindamycin, Sceptra is sometimes used. The choice depends on where you live, what antibiotics work best in that area, what the resistance patterns of the bacteria in that area are, what your child's had in the past. A lot of factors are involved in that. If the infection keeps coming back, or maybe someone in the family keeps getting it and giving it to everyone else, then what we'll do is a decolonization. What that means is that not only will we treat the child, we'll also put some of that mupirocin ointment in the nose and probably use a body wash like chlorhexidine gluconate, which is also called Hibiclens. Might use that. We'll make sure that changing the sheets and towels and pillowcases, but that's something that we're going to want to do every time, even if there isn't recurrent cases. It's a good idea to do those just to get it to go away, even if you've only had it once. The ways we prevent impetigo, all we have to do is think about the ways that we catch impetigo. And so what we want to do is we want to make sure that there's good general skin care, especially with kids who have underlying skin problems like eczema. We got to make sure that their skin is nice and moisturized and not being dried out. So using gentle soaps and using them sparingly. I always recommend Dove bar soap, and moisturizing after bathing or anytime the skin looks dry with something greasy like Aquaphor Vaseline. That's usually what I recommend. Keeping the hands clean obviously is going to keep more bacteria out of wounds and off the skin. Don't pick or scratch at the skin. Keep the nails short and clean and filed so that they're not sharp, like we mentioned. We don't want people to share personal items or clothing. Washing off after swimming, especially in our area with Lake Oconee, which can get a lot of bacteria in it, especially in the hot months like the summer, it's just full of bacteria. So we don't recommend swimming and then sitting around the wet bathing suit all day. That's just going to lead to problems. Also, going in a hot tub, I'd never recommend kids go in hot tubs. We have a hot tub at our house, and right after we use it, we run and take a shower and get cleaned off because those chemicals are just not good for your skin. If there's not bacteria in the hot tub, there's chemicals in the hot tub, and both of them are just bad for your skin. So make sure that you're rinsing off. And like I said, we don't recommend kids go in hot tubs anyway. And finally, if the child is shaving, changing the razor weekly is a good idea to make sure that we don't collect a bunch of bacteria on the razor. So what's the worst case scenario? I mean, these things look bad, but are they really dangerous? Well, there are some pretty serious problems that can happen if the impetigo is not taken care of quickly, effectively, and completely. The first problem I want to talk about is cellulitis. And cellulitis is a deeper tissue infection that can come from a superficial infection like impetigo. And you can see in this picture, it looks like the original injury was a scrape on the hand. That infection on there just got out of control. And now you can see red streaks starting to come up the arm. Those are not abrasions. That is bacteria and inflammation and infection scooching up the lymph system through the lymph vessels and going up the arm. And there's a real danger. This kid is going to get sepsis or a blood infection from this, which is very dangerous. So obviously we don't want to see that. There's a picture of a sad little child who has staph scalded skin syndrome, or SSSS. And I don't know if it started with impetigo, but often it can start with impetigo. But at this point, you see that this child's skin is diffusely red. I mean, it's red everywhere. And not just individual sores, but it's red all over. And the outer layers of the skin in this child will come off in big pieces and big sheets with just a little bit of friction. And you can see some spots, some open spots there on her belly, which probably peeled off. And if we zoom in on the face, you can see that there's peeling areas on her forehead. Almost like when you have a sunburn, your skin peels off. The outer layers are peeling off on her forehead and on her cheeks. And that's from toxins produced by Staph aureus. Untreated staph and strep can also cause heart and kidney issues. And the last thing that I want to mention, because we do have a lot of kids who have eczema these days, and like we said, kids with eczema are at a higher risk for getting impetigo because the eczema destroys your ability to fight against bacteria that are trying to get in your skin. But it also works the other way around. Impetigo can make the eczema worse. So we have to be very careful about kids with eczema. You see it, the impetigo probably started somewhere around the nose, but now it looks like eczema is just flared all over the cheeks. And that eczema will not get better until we treat the impetigo. So that's something we definitely want to take care of. The point of all this is that if you suspect your child has impetigo or cellulitis or something like that, make sure that you're not just throwing Neosporin at this. Oh, it's probably going to get better if we just keep it clean. A lot of times it will not. Staph and strep, once they get a hold of you, they're probably going to spread. You're probably going to chase it around the body with antibiotic ointment. We don't recommend that. So if you have these problems, make sure you talk to your doctor and get it checked out. Well, that's really all we need to say about impetigo. I hope the pictures weren't too graphic, but it's good to know what we're looking for. Y'all know me. I'm Dr. B, and this has been The Buzz of Parenting in Pediatrics. We'll see you next time.